her, with Greg, with Loida, and Yin for putting it all together, to have these different parts of my life come to here in this nexus makes us feel like we're all here for a purpose. So I want to thank everyone that made this possible, Rob, the performers, and all of you for taking your time out on a Thursday night to spend with all of us here to support a vision for a different New York. For those of you who don't know me, my name is Dr. Calvin Sun. I'm an ER doctor. I'm a proven leader in crises, more ways than one. I'm a recent kidney cancer survivor as of 4 or 5 months ago. Wow. Yeah. One thing in common that I do not want to share, but we're there for each other. And I am a born and raised lifelong New Yorker. Yes. I grew up here in this area on the Upper East Side in the 70s. During the 80s, I went to both public and private schools. PS 158, Trinity School, Columbia for undergrad. Wow. And between my sophomore and junior year of college, that's when my life started. My dad died of a sudden and unexpected heart attack. And I remember walking into the emergency room of the old St. Vincent's, and only to find out it was already too late. He was already gone, and not a single doctor or nurse had come up to speak with us to tell me what had happened, because they were too busy taking care of other emergencies. So my mother, who had just been diagnosed with Parkinson's, it was a rough summer, gave up, and she left to be with her parents in Elmhurst, leaving me alone. I went home alone that night, and that was the beginning of my life, and New York took care of me. And after college, I became a patient advocate at Bellevue Hospital. Went on to pursue my medical degree at SUNY Downstate College of Medicine in East Flatbush, Brooklyn, and then my medical training in emergency medicine in the South Bronx at Jacobi and Montefiore Medical Centers, where a majority of my work has been helping immigrants, their families, and other underserved communities navigate our complex healthcare system so that they wouldn't be alone. And then in my 6th year of practice came the pandemic. It was the worst and largest mass casualty of our lifetimes. We've lost more Americans than the Civil War and World War II combined. And our neighborhoods here, this was ground zero. And during those 2 years, I managed emergency rooms across half a dozen hospitals, 4 boroughs. I oversaw hundreds of staff, nurses, colleagues, doctors, residents, and we directly treated thousands of New Yorkers. We also lost hundreds of them. I lost 2 of my own colleagues, and my grandfather died at Elmhurst Hospital. And I remember getting the call. I was working a shift at Mount Sinai, Queens, in between patients, in my rabbit suit, head-to-toe gear, the PPE that I could find, whatever was left over, and having to be there for him as I watched him die alone. That was the purpose of the FaceTime call. I got angry at everything, and I got frustrated knowing that we all lost something, but we could have saved far more lives had our government been better prepared. And those 2 years during the pandemic has formed the motive reason of why I want to advocate for this city, and that is why I am running to be your public advocate for New York City. Because when government fails, it's not the institutions, it's the people, especially our most vulnerable communities, who suffer. And I feel that there's more to just physical health. I already see all the economic and political forces that dictate our lives through the lens of health in general. There's mental health, there's social welfare, there's financial health, the health of our city's infrastructure. So I think of power stations, subway stations, traffic that increases asthma rates because of bad pollution and air quality, that brings tons of patients to my emergency rooms. We see the surge. I take care of them, but then I'm discharging them after I stabilize them back to the very neighborhoods that triggered that asthma in the first place. And they keep coming back. And that is why you wait hours to see a doctor for your emergency or weeks to see a specialist. So this holistic approach that frames our city's problems is known as the social determinants of health. It calls for a broader understanding of how seemingly disconnected policy areas like healthcare, education, employment, public safety are actually collective, connected systemic drivers of our poor health outcomes. We've known since 2014, the data has proven it, it's been reproven over and over and over, that 80% of your health outcomes in this country, let alone New York, is outside of direct medical care. I went to medical school and 4 years of training in emergency medicine, 8 years, to only provide 20% of your eventual health outcomes. The 80% is beyond my care. That is the neighborhoods that they're going back to, the food insecurity, the stress and anxiety over housing or whether or not you can make it here every month. And I believe that if you frame our problems through this lens, can we finally move our city forward? No more call-out culture or shame and blame. We need targeted action. So as an ER doctor, I've not only been trained in, but I thrive in high-stake environments. Every shift, I'm faced with situations where time, precision, and resources matter. There's no room for complacency or stagnation. Inaction is not a possibility. I just can't wait around because lives are at stake. And much like governance, crises in medicine are often the result of systemic neglect, where people come to us at the tipping point of their health because their underlying issues have been underfunded and ignored. And this mirrors the larger societal cycles of inaction, whether it's government accountability, housing, healthcare, and I've learned that to break those cycles requires swift, decisive action informed by firsthand experience. So my role in public office will mirror the same urgency I bring to the emergency rooms in breaking those cycles. Timely interventions, but also prevention and the pursuit of long-term solutions, all while advocating for those who need it the most. So no longer do I want to just stabilize and treat emergencies, I want to prevent them from happening in the first place. I don't want to just be reactive to crises. I want to prevent them from taking up your resources. To change the conversation from surviving to thriving, from the conversations that we hear all the time, especially those in the younger generations, that the kitchen table conversations of whether or not we can make it here every month. I want to transform that to how do we give back to the city that's given us so much? I've been there. So that is why I'm excited to announce that from now until Election Day, my candidacy, my campaign, and when I'm public advocate, we're going to go from neighborhood to neighborhood, speaking to and listening through the social determinants of health. There are 350 neighborhoods in New York City, and I tend to treat each and every one of them as 350 of my own patients, each with their similar but different problems and solutions. And that's just another two. 350 patients, that's just another Tuesday for me, especially during the pandemic. We see that much in one day, and it's not getting better, it's getting worse. I thought we would learn from the pandemic, but we're not, and that's why I'm running. Say hi to Mom. So, from learning from these community health assessments, these neighborhood to neighborhood approach, we're going to gather this information and data. And we're going to leverage it and put pressure on the city government to meet each and every neighborhood's needs, but through the social determinants of health. But this time it's with the urgency of hearing a doctor trying to keep a loved one healthy. And also with the compassion of making sure each and every neighborhood feels they're actually being listened to, and that finally nobody is being left alone. I am the chief medical officer and the lead physician of the Queens 10K race, the Brooklyn Half Marathon, the Bronx 10 Mile, the Staten Island Half Marathon, the United Half, and the annual New York City Marathon every year since 2015. And I've seen, as the lead physician, it's a long story how I got there, but as a lead physician, I've seen firsthand how every weekend we build up and break down medical tents that function at the level of emergency rooms, and better than some of my hospitals, within the matter of hours. And we can identify neighborhoods that are medically starved or hospital poor. We can build those medical needs in those neighborhoods, bringing healthcare to the people. Because right now they're coming to us in the hospitals for their primary care needs. Diabetes checks, blood pressure checks, social welfare checks. They have nowhere to go. They're all coming to the hospitals for that. And that takes a lot of time from our management and billions of dollars wasted when we could bring the healthcare to them by being a more proactive elected official and being more preventative with our healthcare. By doing it at their doorstep instead of coming to the hospitals, we can actually save those billions of dollars of healthcare expenditures and waste. We alleviate the burden in our existing healthcare system, our public healthcare system, and those happening at the same time, they can have the time to actually renovate, retrofit, and become more efficient, thus saving more money. And therefore, this works, we expand beyond healthcare, reinvesting those billions of dollars into small businesses, healthcare startups to save even more money, generate more revenue, and namely what I want to advocate more of is affordable housing. It's expanding the availability of rent-stabilized units, slicing and dicing old regulations, keeping the ones that are compassionate and protect, and getting rid of the ones that are decades old and outdated, so we have renovated rent-stabilized units to make available for our New Yorkers. I want to increase pathways to home ownership, not only for our middle class, to keep our current middle class healthy, but also our struggling, to lift them up to a more permanent middle class. And I am envisioning these community-centered rapid response teams, where we have groups of community leaders, elders, social workers, licensed professionals, so we have a community-centered approach to our public safety and prevention. I want to foster an environment where the New Yorker feels that their neighbor is actually looking out for them, or they themselves are imbued with a responsibility to their fellow communities. I want to foster an environment where we're creating 8.2 million public advocates, because we are at an inflection point. And right now, our government has humiliated us, has shell-shocked us, it has shaken our faith in its institutions to its very core. And in no time do we need a more competent elected official, public advocate of a new generation that can remind you of a government when it puts our neighbors first, a government that is compassionate, empathetic, efficient, responsible, reliable. And I believe I am that elected official, that public advocate that we need. And therefore, I thank you for coming here. I am honored by your support, and together I am ready to fight with you for a healthier New York that we all deserve.